Welcome to the pREBOA-PRO catheter unboxing and quick reference guide. In this video, we will provide you with an overview of how to place and remove the catheter. Use this video in conjunction with the other training provided by your PREBOA medical representative. To begin, open the pREBOA-PRO box and remove the sealed tray. The box's contents include a handy quick reference guide. It is affixed to the outside of the tray and contains a convenient visual step-by-step summary for the pREBOA procedure. Let's remove the pREBOA-PRO catheter. To open the tray, peel back the Tyvek lid from the upper right and remove the catheter. Insert your fingers below the extension lines. Lift the extension lines until the stopcocks pop away from the tray. Then simply pull the catheter out of the box. When you receive the pREBOA-PRO catheter, the balloon has been specially manufactured to be ready for immediate insertion. It is not necessary or recommended to unsheathe the balloon or insert air or liquid before use. With the orange peel-away sheath in place over the balloon, get the 30cc syringe from the pREBOA convenience kit. We recommend that you use a 30cc syringe during the entire pREBOA procedure, from placement to inflation to deflation. Fill the 30cc syringe with 30cc of saline or 3:1 mix of saline to contrast. And attach the syringe to the balloon lumen of the catheter. Flush a small amount of the saline into the balloon lumen until the safety valve opens. Next, pull a vacuum on the syringe plunger and close the stopcock. Now, advance the orange peel-away sheath to straighten and capture the P-tip. Connect the above balloon art line to the red stopcock of the pREBOA-PRO catheter. Flush the lumen until a continuous stream of fluid exits the distal tip of the catheter. Connect the below balloon art line to the side arm of the 7 French introducer sheath and thoroughly flush the lumen. Take a moment to familiarize yourself with the shaft of the catheter. Printed on it are marks to identify the average center of zone 1 and zone 3 in centimeters for quick reference. Use these marks to determine the insertion depth for catheter placement. Now it's time to insert the catheter via the 7 French introducer sheath. Insert the orange peel away into the valve of the introducer sheath until it reaches a hard stop. Advance the catheter approximately 10 centimeters before removing the orange peel away from the valve of the introducer sheath. Then, continue advancing the catheter to the target location. The orange peel away may be removed from the catheter shaft as needed by pulling on the 2 tabs. Once the catheter has reached the target location, flush both art lines again to clear any blood that may have backfilled during catheter insertion. If available, use X-ray or fluoroscopy to confirm placement. Radiopaque marker bands are located at each end of the balloon to identify the balloon's location. Slowly inflate the balloon to occlusion while monitoring the patient's blood pressure for signs of an increase in pressure above the balloon or loss of pulsatility below the balloon. The built-in safety valve is designed to only open if the balloon is inflated too quickly and help prevent overinflation. Use the securement clip provided in the pREBOA convenience kit to secure the catheter shaft near the introducer sheath to help prevent device migration. A documentation tag is provided for your convenience. Use it to note the time when occlusion begins. In addition, you can use the tag to note the depth of insertion, amount of saline used to inflate the balloon, and blood pressure. To perform partial pREBOA, slowly deflate the balloon until the desired physiologic response has been achieved. When making minor adjustments, keep in mind that the numeric values on the vital signs monitor may be delayed from 3 to 10 seconds. So it is important to allow time for the monitor to normalize between adjustments. A 30cc syringe should always be used for initial inflation and final deflation. A stronger vacuum can be generated with a 30cc syringe, rather than a 10cc syringe. Now that you have the balloon placed and inflated to your desired setting, you can now move quickly to definitive hemorrhage control. After definitive care and when occlusion is no longer required, slowly deflate the balloon using a 30cc syringe while closely monitoring the patient's response. Fully deflate by pulling a strong vacuum on the syringe plunger until the fluid or bubbles in the extension line stops moving. If the fluid starts moving again, continue to hold a vacuum and wait for it to stop moving. Once the fluid stops moving completely, slowly count to 5. 1, 2, 3, 4, 5. And then close the stopcock. And then release the syringe plunger. Next, disconnect the ART line. And remove the catheter securement device from the catheter. You can now begin to gently remove the catheter from the patient. As you approach the 20 cm mark, begin twisting the catheter to help the balloon collapse against the catheter. The catheter should continue to withdraw gently and smoothly. Once the catheter has been removed, manage the access site and remove the introducer sheath using standard techniques. Confirm full and equal pulses in each leg. Thank you for your time today. If you have any questions, please contact the pREBOA Clinical Education Manager dedicated to your hospital.